Good evening and welcome to my YouTube channel Pain Free Partha. And all my slides are also available in www.painfreepartha.com and for freely downloadable and editable. So, Sir Anton Jayasuriya is supposed to be the father of acupuncture, and I have got this book, Clinical Acupuncture. And this photograph was actually a shield given to me by this person, Anton Jayasuriya. He's an MBBS FRCS who practiced acupuncture, who taught me major portion of the acupuncture. And that shield was there because of my lecture given in 1990s to how to integrate modern medicine with acupuncture. So what is acupuncture? Acupuncture is a system of medical treatment and ideology. Principle of applying small needles and pressure to specific points. Acus means needles, puncture means prick. That is what is acupuncture. Sometimes we give pressure, that is acupressure. We will come to that later. The earliest known written record of Chinese medicine of acupuncture is 3rd century BCE, but only in 1959 it came to India, and this person is supposed to be the doyen of acupuncture in India, Vijay Kumar Basu. And the WHO has given the guidelines on basic training and safety of acupuncture. How does it act? It just stimulates some points. What they say is, it causes homeostasis of the flow of energy through the points. That is what they say. Now, what is scientific acupuncture tells us? There is a stimulation and endogenous opioids. There are a lot of other numerals. Gate control theory, motor control theory, motor gate theory. So many things. In Chinese medicine, yes, the vital energy, yin yang theory. That is what is the point is about holistic wellness and harmonization of the energy at these channels. There are studies even done as MRI changes on acupuncture therapy in depressions. Now, adenosine A1 receptors mediate local antinociceptive effects. There is there. Now you can see here sodium receptors, TRP1 receptors, vanilloid receptors, that is concerned with substance P, descending modulation here of acupuncture. The descending control of pain is modulated by acupuncture. Now we can see descending inhibitory system, ascending inhibitory system, activation of A fibers, so many things. So I will tell in detail. Before that, I have my own theory of CRPS, complex regional pain syndrome. Factors promoting CRPS is sympathetic, sensory, psychological, motor facility, substance P, and inflammation. I will put this, all these things are countered by electroacupuncture because motor is okay, antidepressant, opioid release, decreased sympathetic drive, and anti-inflammatory. So nothing. If you give a CRPS care and if you give a stellate ganglion block, you are getting only this. There is no motor facility improvement, but electropuncture does it. This is what is my theory of electroacupuncture in CRPS. Now, if you go to the mechanisms in summary, there are nociceptor changes, endorphins, substance P, anti-inflammation, adenosine receptors, descending control of pain modulation, anti-inflammatory effects, so many theories. This is what is the now lung meridian, heart meridian, pericardium, triple worm, small intestine. So large intestine goes like this. Pericardium goes like this. Spleen goes in the leg. So there is no anatomical connection between this lung meridian and the lung. Anatomical connection is not there. There are 4 types: acupressure, acupuncture, laser, moxibustion, even ultrasound has been used. Electroacupuncture is this. The black is the active electrode. This is the active electrode, electroacupuncture. What are the indications of acupuncture? Back or neck pain, osteoarthritis, migraine, post-therapeutic neuralgia, CRPS. Labor pain and post-operative pain. What I want to tell is the indications of acupuncture for me orients towards pain mainly, And so that we are, as anesthetists, are grossly concerned with this, because this is about chronic pain and this is about acute pain. Both have indications in acupuncture. There are a lot of other indications. P6 acupuncture in PONV is there. There are articles published even in Canadian Journal of Anesthesia. Stress organs, fibromyalgia, acupuncture, and opioid addiction. So, patient is an opioid addict. Start acupuncture and decrease your addiction. The diaphragm, I have used long month in organopause plus poisoning with diaphragmatic weakness. This is the point which I use. Two sides. Acupuncture in the treatment of acute toxicity of cancer therapy. See, simulation of P6, already I have told. This is an all Cochrane database. Tune means the breadth of one thumb of the patient. Now, we cannot say this point is 2 centimeters from the lateral epicondyle. Not like that. It is tune, patient's own thumb width. This point, LI10, large intestine 10 or 11, is to tune from the lateral epicondyle. That is what you should tell. There are one tune needles and half tune needles are available. CHUM is the word that the Chinese describe. There are silver needles, there are copper needles. What I usually use is silver needles and dispose them off. There are point detectors. Now, I had my point detector, but now it is not available. What it does is, they say in acupuncture point has got little lower skin resistance. This is picked up by the point detector. Now you do like this. There is a red light. So that means that area has got little skin resistance decreased. So you should not go on like this. You want to focus a point to tune inferior to the lateral epicondyle. There you slightly change. The red light will blow. That is what is called a point detector. Just prick one scope to get the D-side. That is very important. The patient will, that is very important. You should get the D-side to get the acupuncture working. Sometimes it is there for 20 minutes, sometimes for 30 minutes. The acupuncture action is over. We can take the removed needle out. How to know that? The needle will come very loosely. If it tightly comes, then we have to keep it for some more time. Maybe 7 or 10 sittings may be enough for many of the diseases. Ashai points means OS. This is an OS point. Can do puncture also. Painful. Some say they are very close to trigger points. There are alarm points. CV12 is an alarm point where we can see something here is an alarm point for the stomach. Okay, acupuncture, we have got the mechanisms. Gate control theory, motor gate theory, adenosine receptors, vanilla receptors, endorphins, all these things are there. Now, what are the indications? Pain is the main thing. Pain, acute pain and chronic pain. And other indications are what I have. My personal experience is excellent for acute pain, excellent for labor pain, and very good for chronic pain, especially neuralgias. And the drug of choice, the technique of choice for CRPS. Whenever we do acupuncture, the next day they will come because there is an endorphins. They feel fantastic. Euphoria will be there. Well-being is there. There is improved sleep. And they get little relief. Be patient. Sometimes acupuncture starts to work by a fifth sitting. So it is not like some ibuprofen, take pain decreases. When we should not use automatic implanted cardiodefibrillator, infection at the site. Epileptic, we can use acupuncture, but no electroacupuncture. Pregnancy and warfarin are not contraindications, but beware. We should know the anatomy. That is why I am telling acupuncture should be handled by MBBS or people who know the anatomy, qualified practitioners. So because they know where is the brachial artery, because they know where is the cephalic vein. What are the complications? A foreign body is introduced to the patient. Is it a source of bleeding can come, infection, irritation, everything can come. Sometimes you put acupuncture here, pneumothorax can come, pneumoperitoneum, organ puncture, all these things can come. but they're all very rare, except a very mild, controllable, easily controllable bleeding. I must have used 10,000 cases of acupuncture. I have hardly seen any other complication other than a trivial, well controllable bleed. Sometimes they do sham acupuncture. Sham acupuncture means what they do is acupuncture at a point different from the described point. It is very difficult to do RCTs. Acupuncture and auriculotherapy. Now, what Anton Jayasuriya tells is, if the earlobe is like this, the body, our body is represented like this. Now, you see this needle where I have put is along this line. Now, you can see here, where is this? Around this thing. Probably, I am doing it for an osteoarthritis knee. So that is where is the possible action here. Hip and osteoarthritis. This portion is this. For example, now we have a migraine or a trigeminal neuralgia. Now you see, I need to put it here somewhere. Effect of perioperative acupuncture assisted GA. What happens? Acupuncture assisted GA is there. Less GA anesthetics, less inhalational agents. The effects of acupuncture in anesthesia for craniotomy, a meta-analysis. This is 2017. That is fantastic. I have told already, your narcotics is less, your agents are less. And now we see the readiness to discharge. Extubation is better with assisted anesthesia. What can acupuncture do in anesthesia? What can? Yes, everyone knows pieces of acupuncture, less nausea, vomiting. Better sedation, it gives like euphoria, all these things. Narcotics are less. And less IV. Sedation is there. Less IV because already I have told you, endorphin is one of the theories. Okay. Capsaicin is another theory, substance P. So, anti-inflammatory, painkiller, sedation are the main effects other than motor stimulation. Okay. So, these three effects are essential for this so-called anesthetic technique, which decreases all these agent use. Acupuncture and COVID-19, because anti-inflammation, immunity activation, all these things are there. So they have used acupuncture in COVID-19. What they have told in 2022 is evidence on underused in clinical practice and health policy. There are so many effective therapies there. Acupuncture is very effective with many things, but it is underused. What all AI can be helpful in acupuncture? Standardization of acupuncture, acupoint descriptions, personalized acupuncture therapy, efficacy prediction. Yes, this patient, a 46-year-old patient, has come for post-herpetic neuralgia. Now you can see the AI. This is the patient. This patient has got a possibly post-herpetic neuralgia of C8 or something like that. Now you can say to the AI what all the points, how far is the prediction of this patient, better or not. The eye needles have developed to allow the analysis of metagenomics, metatranscriptomics, and host microbiome relationships. While skin implantable needle-shaped microsensors, see here, you put the eye needle here. They assess the micro-environmental changes in acupoints and target organs. Now we have a migraine, we have a target there. Now it also, this eye needle senses what happens inside this area and also in the target organ. Now our experiences, acupuncture, does it need a real relook? Yes. This is published in 2001 in Indian Journal of Anesthesia. Acupuncture and analgesic supplement in post-appendicectomy pain. What we did was, in the legs, 3 points were, that was with button needles. Button needles is a needle with a button like. We press and it will be there. So what we did was, we put a plaster above that and in the control group, plain plaster alone. And we did this acupuncture decreased by 25 to 30% in the post-operative pain. Now, I have already told complex regional pain syndrome. This is a complex. See here, swelling, pain, edema, all these things. This is excellent. Why I have pricked? This is an agu point. Agu means analgesia point. This point is agu point, and exactly here is the DU point. That is sedation, harmonization. what I feel is when you stimulate this dew point, there is a definite sedation. I thought when we do like this in Sundays and do a good oil bath or something like that, we are not allowed to go out by traditional methods, probably because of sedation. We don't know. Use of electroacupuncture in Bell's palsy. Yes, because it is anti-inflammatory, because it is motor stimulant. These are all the effects of electroacupuncture in Bell's palsy. Acupuncture, a preemptive analgesic technique. This was sent to British Journal of Anesthesia long back. It must be done. See the year 2009 it is published, and 2007-8 it was sent to BJA. And BJA, both the reviewers were very happy about the technique, but the problem was they did in statistics and rejected the articles. What I did in this case, in simple hernia, before 1 hour before the operation, I inserted acupuncture needles and removed after 30 minutes and gave spinal anesthesia. Plain. What happens is here, there is a difference in the substance P here, possibly, and endorphin release here, possibly. That is why they had better sedation in drop, and the postoperative analgesia was less in patients who had preemptive acupuncture. Yes, we know stroke pain and is a panacea for both because we need motor stimulation and we need pain reduction. This is my first case of acupuncture anesthesia, GJ done for CA stomach. And this is in 1997. Labor anesthesia, yes, I have put long time back. These needles here, possibly Hegu, Behoi, Niemann, San Yen, Geo. These are the points. This is what I told. There are a lot of other sites, yes, we can use for dogs, cats, etc. Now I am doing this for plants. You stimulate plants in that area. Yes, I have written a review article and it is pending with reviews in a journal. So what is summary? Acupuncture? Acus means needle, puncture means puncture, and mechanisms. So many are there. A1 receptor, endorphin, motor gate theory, gate control theory, so many theories. Anti-inflammatory. What are the types? We can put pressure, laser, ultrasound, needle, electroacupuncture. What are the uses? So many uses. PONV. So many uses. They are used even for allergic rhinitis. So uses what we are concerned with is about acute and chronic pain and also with PONV. Or the complications are, I'd say, minimal bleeding. Yes, nerve injury. Yes, possibly pneumothorax and pneumoperitoneum have been, visceral injuries have been reported, but extremely rare. Contraindications I will put at AICD and patient not willing. Pregnancy, warfarin, not a contraindication. Yes, visit me at Pain Free Partha YouTube and thank you all for the patient listening. Listen and subscribe to my channel.